In our series of presenting research or faculty research labs, this week we'll be presenting a study that has been performed here and also across other institutions that they'll talk about. So the study is CULTIVATE, COVID-19 retrospective study to assess PT treatment in the ICU for patients with ARF. Please, Dr. Ginoza and Dr. Martinez, take it away.
Thank you, Dr. Missioner, and thank you for the introduction and invitation to present today and for introducing us to this CULTIVATE group. So today I'm presenting on behalf of my Minnie Jan and Clarisa Martinez, who are the USC team that is part of this USC or part of this CULTIVATE collaborative team. So other individuals in this collaborative team are from the University of Kentucky, Cleveland Clinic, University of Michigan, and Vanderbilt. Let's see. Went too fast, sorry. The project aim of the USC team has been leading is to describe rehab treatment parameters and level of function for patients with COVID admitted to the ICU from March 2020 to May 2021. And so today we're just presenting a portion of that data. And so there was a total of 3,695 charts that were analyzed in this assessment, if you will. And so 78.5% came from Cleveland Clinic, 10.4% from University of Kentucky, 9.6% from University of Michigan, and 1.5% from USC, which is inclusive only of Verdugo Hills and Keck Hospital. So just a brief demographics overview. There is a higher percentage across all sites for male versus female. And the mean age range was 60.1 to 65.7, and the mean BMI range was 28.6 to 34.5. And when we kind of looking at mechanical ventilation needs, so when we break this out, 42.9% of these patients received mechanical ventilation, and the mean mechanical ventilation duration days range from 11.5 to 22.4. And thinking about who then received PT, who did not receive PT, we look at that. So the good news is the majority of patients across all sites receive PT. At Cleveland Clinic, that percentage was 53.9%, University of Kentucky, 73.6%, University of Michigan, 78.5%, and USC, 68.4%. So two other data points we looked at was admission to first PT consult, and the mean days for that ranged from 6.6 days up to 12.3, with USC being at 8.8 days. And then the number of PT sessions received. So for that, the mean visit number ranged from 3.7 to 7.4, with USC at about 5.6. And later we can let Clarisa speak more towards the specific stats. And so the other measure that is used quite a bit in the inpatient is the activity measure for post-acute care, or the AMPAC-6. And so the score range for this is 6, meaning the total, 6 is the total functional impairment, and 24 is the total absence of impairment. And the basic mobility measure to look at disability or amount of assistance needed would include bed mobility, sit to from stand, seated transfers, or ambulation. So AMPAC at eval, which would be PT eval, range from 10.8 to 14.7. And then the AMPAC at discharge, which is usually the last PT visit or OT potentially visit encounter, was 3.7 to 16.6. So USC sort of sat right in the middle at 14.4 on eval and 16.6 on discharge. So really quickly, discharge destination kind of looked at where do people go home versus mortality rate. So speaking specifically to USC, mortality rate was 46.55%, and discharge home independently was 29.31%. So this is our poster that we will be presenting at CSM with a lot more data. But I think one of the things as we continue our data analysis is kind of going to be asking you as our audience or our CSM audience, like what data is meaningful to you and how would you go about pulling out this meaningful data? There's definitely a lot of discussions. That is why Clarisa is on the team helping us out here.
Yes, so this has been a really great opportunity to look at data across 4 sites and start describing the variation in care for patients with COVID. We don't know a lot about what care looks like, and I think this early look helps us see that there's a lot of variability across site, both in how sick people were, where people were discharged, and how much PT people received. So it was very interesting to take a look at that, and we're happy to entertain questions about that.